Dr. Kevin Kavanagh is our expert. He is the founder and president of a national organization called Health Watch USA. Good morning, doctor.
Good morning, Jack.
Good to have you with us. You were quoted in a story this week in the Louisville Courier Journal. If you had been here and we weren't socially distancing, I would have given you a big hug over that one.
Thank you.
Yes, the Louisville area preacher that is defying the ban on mass gatherings. He's not the only one, of course, but he's gotten a lot of publicity this week in the press, and he's going to have a Sunday service, and he doesn't care who has a problem with it, and you have a problem with it. Tell us why and your opinion on this.
Well, this is a huge problem, Jack. This virus is extremely infectious. The CDC just released a report that this has an R0 of 5.7. That means that every person that gets the virus will, on average, infect 5.7 people, which is huge. The common flu, if you have 3 people get the virus, they would infect 4 people. That's all together. So they have an R0 of 1.3. It spreads in the air. If you sing, I believe it's going to aerosolize. There have been reports of choir practices where a tremendous amount of people have been infected, had deaths, and been in the hospital. So singing in a closed, confined space is extremely dangerous. The infection rates may go up to 75% of the people in attendance, and that's with some of these reports that we're looking at. And so this is very ill-advised. It's a setup to spread the virus, even worse than nursing homes. Granted, nursing homes are bad, but if you're in a nursing home for an hour and come out, it's not going to be as bad as being in a church, singing and having a service in close quarters, and then coming out. Personally, I think it's probably the most dangerous place to be in this epidemic. And as a side note, this infectivity really does mean that we need to start wearing masks in public. New Jersey's now requiring all retailers to have their patrons wearing masks. And personally, in Kentucky, I'd like to throw out the suggestion that grocery stores for the first hour have the elderly and those at high risk to come in and shop. And after that, let's have those patrons that are wearing masks giving special time to come in and shop.
That's a good idea. Yeah, that'd give them an incentive to wear them.
That's right, incentive to wear them and safety. Because, it makes little use of me wearing a mask and no one else does. Because remember, the main reason of wearing a mask is if I'm an asymptomatic carrier, I'm not going to spread it to someone else. It doesn't protect me real well if having someone else spread it to me. I'm not wearing goggles, not wearing a bodysuit. So just wearing a mask won't do that. And that way really, I think, motivate this type of a behavior. So I would like to see that done. And I'm also very worried about our hospitals, and our healthcare workers are being exposed to this. The new CDC guidance, to me, is somewhat scary. And I think going down the road of what New York is doing is possibly having some hospitals being for COVID-19 patients and other hospitals not. Because one of the dangers we may get into is that patients who do not have this disease but have a serious problem are now scared to go into the facility because of the COVID-19 problem, not having enough N95 masks, having the new guidance where workers that are exposed to the virus can still work with a mask and as long as they don't have a temperature. But of course we know that 25% of the people who have the virus don't have symptoms. And up to 48 hours before you develop symptoms, you could still spread the virus. So that is really a last-ditch necessity type of a recommendation rather than something for maximal public safety. So if we're going to that type of a recommendations for infection control, I think we need to really consider having non-COVID-19 facilities for patients to try to come into and be seen, and maybe try to get a little bit better safety. Of course, you still have the problem of asymptomatic spread even in those facilities. So the key here is, along with opening up our economy, is getting a test, a rapid test for people so we can start to figure out who has this, who doesn't have this, and to get an antibody test so we can figure out who did have it, recovered, and is immune. So I'm sorry about the long answer, Jack, but this is a highly infectious virus. We need to change the way that we are living, at least temporarily, and having church services on Sunday is probably the worst idea that you can have.
Dr. Kevin Kavanagh is with us this morning, and just a few minutes remaining in the program. From our Auto Tech Service text line, Doctor, here's a question. Do you think followers of this Louisville preacher would be willing to put their hand on a Bible and swear to their God that they would not endanger medical professionals by seeking medical help when they come down with the virus? How can you stay within social distancing recommendations and still pass the rattlesnake back and forth?
Well, that's a kind of a loaded question. Who knows? But one thing that you need to understand, it's not just when people think they're infected. They can pick up the virus and then spread it asymptomatically or spread it when they don't even have symptoms. And this can occur, and this is one of the major drivers of this epidemic. So that's why wearing masks in public is so important. As I said before, I think grocery stores should have an hour time in the morning for people who wear masks to come in and shop. In New Jersey, they're now requiring all patrons to wear masks. So public wearing masks is of utmost importance. For me, I get my groceries delivered, non-perishables. I sit them in the garage for 3 days and then bring them inside. So that, I think, is very, very good advice as far as trying to keep from infecting others. Remember, masks do not prevent you from getting an infection as much as preventing you from infecting others. And I'm talking about the homemade DIY masks. The N95 masks need to be safe for the healthcare workers.
Right.
And unless you've got a hazmat suit and goggles, probably you are not going to prevent yourself from getting an infection if you get close to someone that is spreading the virus.
Here's another text. Shouldn't we be concerned that we aren't able to build up natural immunities to this? I've never had a flu shot and have only had it maybe once or twice in my 60 years. Let people build a natural immunity. What do you say?
Well, it is possible, but I mean, it takes a long time to do that. I mean, decades. And we don't really have time the first time you're exposed to the virus. But this virus being as infectious as it is, over 80% of the population would have to be immune before you get what's called herd immunity, where one person can protect another person from being infected. And so probably we're going to have to wait for a vaccine to come about. And luckily, it looks like they're going to be able to develop one. They've got 5 or 6 or even more manufacturers looking at testing these vaccines. And, well, it's more stable than the flu virus. So I think a vaccine, once you get it, will provide a lasting immunity. At least that's what I'm hoping. So that's what's very important. The idea of going out and getting everybody infected at once, number one, will overrun our healthcare system, and you can see the fatality rates going up to close to 10%, as what's happened in some areas of Italy. And two, if you have a virus spread around that much in the population, and it's an RNA virus, it could mutate to a new type, and you start the process all over again. So it's better to snuff it out when you can and snuff it out early. And that's why staying at home, if you call it shelter in place, that's fine, but stay at home, avoid contacts with the public until we get some of this testing up and running.
And what's going to happen, which has already started to happen because we've got a text here that says so, is people start griping about the vaccine when we have one. Here's a guy that says we'll never take vaccines, do not work, full of heavy metals that are neurotoxic. So what do you say to that?
Well, they're not full of heavy metals. I mean, the single-dose vaccines, from what I've seen in research, don't even have those metals in them. And, you get more mercury in a bite of fish than you do in a dose of vaccine, even if it has mercury in it, which they don't. That's crazy.
Yeah.
This virus can kill people. You don't see 1% of individuals dying from the vaccine. I mean, you've never had a death in Kentucky. I remember we had one person say, well, called in with a question, how many people have died in Kentucky from the flu vaccine? Well, that was easy, none. But yet we have flu deaths, and this is even more deadlier than the flu, much more.
Okay.
So you need to get a vaccine.
We got 30 seconds left. I'm going to give it to you. What's your message?
Well, the message is you need to stay safe, take this seriously, and do not get into the mindset that once we're down the slope of the curve that things are safe and you can go out and not social distance and be behaving like you did before. Remember, until we get a vaccine and testing, we still need to practice these safe social behaviors.
Dr. Kavanagh, thank you. Be safe, and we'll talk to you next week.